I'm answering a really serious topic today about a uncommon but serious complication of dermal fillers. This is asked from Rebecca Bald, one of our followers on Facebook, and she asks about blindness as a result of dermal filler injections, that is, dermal fillers causing blindness. And she asks, how can this be prevented and what do we do? So yes, it is true, it is a very rare and serious complication, but it is possible to go blind from having dermal fillers done. This is something that's always in the back of my mind as a practitioner, and something I'm always thinking about every time I do a dermal filler, about the possibility of this and how I can avoid it, and also, explaining this risk to patient is something which is, I guess, not always done, but probably should be, even though it's quite rare. Basically what happens, just to give a quick summary, is that fillers can be injected into the arteries which supply the eye, the retina, and basically the filler gets pushed back along this artery to the back of the eye, to the artery at the back of the eye, which supplies the back of the eye, the retina, and as a result you get death of those cells and loss of vision, usually in one eye. Now this is all pretty scary. It is extraordinarily rare, however, and different studies report different numbers. I've heard around 40 to 50 in one study, approximately half of those being as a result of dermal filler and half of those as a result of fat transfer to the face, so injecting your own fat into the face. Other reports have said up to 100 people in the world, but my general feeling is that this is possibly underreported, and maybe if people have a partial deficit it's not reported, or maybe these things in other countries have gone unreported, maybe in countries where there's not such tight regulations. Basically the prevalence is low if you compare it to the number of dermal filler treatments that go on in the world. So you're looking at millions and millions and millions of treatments, and the risk of blindness as a result of dermal filler is, in comparison to the number which have actually been done, is extraordinarily low. But nonetheless, it's such a serious complication. You walk in for some fillers, hoping to look better, hoping to feel better, and to have a complication like this is life-changing for the patient and for the practitioner as well. I've been very fortunate in my career of 12 years of injecting. I haven't ever had a case of blindness, and hope to never have one. But it's something that is it'd be disastrous, absolutely disastrous for everyone involved, and that's why I thought I'd talk about this today with you, to explain that to you, that there is a risk of it, but it doesn't mean you shouldn't have fillers done. It just means that you need to understand that who you're going to and the techniques they're using. So you need to make sure that who you're going to understands the things that needs to be done to prevent this sort of complication from happening. So that's the first thing. And also, I guess, if it is a risk for you that you can't tolerate, then I guess that hopefully this video will stop you from undergoing a procedure which you would have undergone had you not known the risks. And look, I've actually had just to put this in context, I've had a patient who was actually blind in one eye and wanted some nose filler. And I said to him, look, I'm not doing it for you, because basically, if on the off chance that you do go blind in the good eye that you have, you will be completely blind. So I actually refused to do his treatment for him. So you have to put, you have to have, I think, an understanding of the context of this within each patient as well. Let's go into exactly the mechanism of how this happens. So if you look at the face anatomically, it's full of arteries and veins. In fact, we can't even imagine how many there are. There are thousands literally running all different parts of the face, supplying everything from the skin down to the bone. These arteries traverse through different depths and of course they're all sort of interconnected in a way. So there's a lot of anastomosis, which means basically interconnections between one artery and another, and what happens in incidents where you get blindness from dermal fillers is that your filler is actually being injected into an artery, and it passes usually backwards against the flow of the artery, against the flow of the blood, and backwards into the arteries which supply the back of the eye, which then causes death of those retinal cells. So you basically kill off the back of your cell because it doesn't have a blood supply due to blockage of that blood supply with the filler. So quite scary stuff, very, very scary stuff. And because we don't see the anatomy of the face from the inside, we only get to see the skin, the surface anatomy, we're basically injecting without any visual guidance. So we can't see, we can't use ultrasound or some sort of imaging technology to visualize the arteries. It's too complex, so it's impossible to do that. So basically we inject without any knowledge of exactly where the arteries are, but we do have an idea, but we can't precisely pinpoint the artery in a certain person. And remember, everyone is different, so arteries may run, for example, along the nasolabial fold. And one person it may run outside the nasolabial fold, one person it might run inside the nasolabial fold. So you don't know where that main artery is going. It could be either direction or either side of the nasolabial fold. So, we can't be 100% specific as to the anatomy for each person. But there are sort of areas which are more risky than others, and for example, the central part of the face is very highly vascular, and often that's why in Asian countries, for example, where you get a lot of people who inject their noses or around that area, they often have a high incidence of blindness in their countries because they inject so many noses to make the nose taller, and that's a very vascular area which leads onto the eye. So that is a risky area to inject, for example. As the more lateral we go, the less likely we have blood vessels that are associated with the eye area. So the more centrally we are, the more likely the risk. So the key risky areas would be the forehead, frown or glabella area, the nose, adjacent to the nose, the nasolabial folds. These are the key areas. The facial artery runs up from the heart, up the side of the face, along the side of the nose, through back to the back of the eye. So you get a lot of vascular supply, arterial supply through the central part of your face. So certainly if you're looking at having any part like those areas injected, forehead, glabella or frown, nose, nasolabial folds, then your risk is much higher. I mean, the ironic thing about this is that going back when we first started doing fillers, I'm talking about 10, 12 years ago, and fillers were generally they were in their infancy back then, or certainly not nowhere near as advanced they were now, the techniques anyway. And pretty much patients used to come in and always say, inject my nasolabial folds, and they still do say that nowadays, but we don't inject them as much because generally we direct them to other areas, because filling the nasolabial folds is not aesthetically an amazing place to fill. But back then we used to say, we used to be good doctors and listen to our patients and say, okay, we'll fill your nasolabial folds for you. Little did we know back then that the nasolabial folds were actually one of the key areas for vascular complications, including blindness. But because it's such a vascular area. But we injected thousands, and we were very lucky to get away with no complications in this area in the history of doing this. Look at actually what's happened in the past 10 years. The knowledge and the the awareness of these sort of complications have increased and increased. So it's interesting, when we used to go back to just thinking of conferences, cosmetic conferences that I used to attend many years ago, there was never any talk about this, and now in more recent years, conferences often have a whole half day or whole section associated with vascular complications, not just with blindness, but with complications of injecting filler into an artery. And yes, there are, just as a side point here, there are other possible vascular complications that you can get from injecting filler into an artery. For example, you can block off an area of skin, it's the blood supply to an area of skin, so that would cause death of the skin, which at worst could cause you to need some sort of surgery to put some new skin there, so put a skin graft there, for example. That would be also a very serious complication. And I think the incidence of that is actually a lot higher than the incidence of blindness as a result of dermal filler. Now we'll go on to the next part, which is how do you treat blindness as a result of dermal filler? I'm talking more about the immediate management. Now this might not be something necessarily as relevant to you as a patient, but it's interesting to know what the treatment is. And as practitioners, we have very little experience in this. I have no experience in treating blindness as a result of dermal filler because I've never had a case. But as a whole, because there's been so few cases, we really don't have a lot of experience with treating it. And the success of treating it, I believe, has been very low. So I'm not aware of many cases which actually have been treated successfully once the patient goes blind. But I have spoken to a few of my colleagues who are ophthalmologists, and one of the ophthalmologists I spoke to said that the first thing you should probably try to do is massage the eyeball to try and push that filler out of the circulation there. So that could be a possible initial first step. But really the key thing is to try and get rid of that filler in the artery at the back of the eye. So what you'd really want to do is use Hyalase or hyaluronidase, which is a filler dissolver. So we commonly use this filler dissolver for dissolving, say, things like lumps or bumps or excess filler. But this would be probably the number one thing you could do to help avoid or help reverse blindness that has occurred. And you actually need to get the dissolver to the back of the eye. So this is where it gets a bit scary. So for the doctor involved, now interestingly, I think very few doctors are actually trained in this technique. I mean, I did some anesthetics back before I did cosmetics, and this technique is actually used to get local anesthetic at the back of the eye before you have a cataract surgery. So it's the same technique, but instead of injecting local anesthetic, you can inject dissolving agent. So you can actually you have to get the needle and inject it right behind the eyeball. So you have to go just in the orbit there and go right behind the eyeball and inject the dissolver right behind there. So with the hope that the dissolver would pass through to the arteries that are blocked by the filler and then resolve the impending death of the retinal cells there. So that would be the treatment, the ultimate treatment for someone who goes blind. And that's it sounds absolutely crazy. You could imagine the scenario of someone having fillers done and then going blind, and then the doctor having to inject a needle right to the back of the eye. It's a bit like Pulp Fiction, that scene where they have to give the adrenaline straight to the heart. I mean, it would be absolutely terrifying, I think, for both parties. So the treatment really is not something any of us will get to or have to be involved with, but probably more important for us is to know about is the prevention. So how do we prevent, as a doctor, how do I prevent causing blindness with dermal fillers? And you've got to think about it. as painful as it is to think about, you know, the consequences, you have to sort of think about it in advance. It has to be in the back of your mind at all times when injecting dermal fillers. Now, I do explain, when I do inject risky areas, I do explain the risk to my patients of blindness, but you know, it's sometimes a touchy area to touch upon, and you know, you do have to put it in perspective for your patients. But I guess first thing would be to make sure your patients understand the risk, and you know, that gives them an opportunity to back out of that treatment, or to try something else, try other treatments or whatever. But so that's the first part. Now, second part of the prevention is the technique, really. So the technique that I use, or your doctor uses, for injecting the dermal fillers. Now, because the face is filled with arteries, you know, I wouldn't be surprised if we're actually injecting into arteries a small amount of filler now and then. I wouldn't be surprised if that was the case. But I think the amount we inject could possibly be too small to make any problems, or maybe you know, it just gets in there and nothing happens. So I think the first thing is to inject slowly. So you don't want to be too quick on your injections. That, for me, that means putting less pressure on the plunger, on the back of the plunger, when I'm injecting. So when I'm injecting, I inject slowly, don't put too much pressure on the back of the plunger, and watch the patient, watch for any signs of pain, which can be associated with injecting near an artery or vein. So sometimes when you inject near artery, vein, or they get a bit of a twinge, so if they have pain, you will stop. And injecting really slowly, and watching the patient, watching the skin, watching what happens as I inject. And I think that's really important. The next thing is to use cannulas in appropriate areas. So where, especially in high risk areas, for example the glabella or the frown area, if I have to inject that area, then I use a cannula, which is basically a rounded tip needle, so it's not sharp at the end, it's rounded. So if it hits against an artery, it will hopefully push past it, as opposed to a needle, which if you hit an artery, you may insert the needle into the artery. So that would give you an intravascular injection. So using a cannula will potentially avoid the artery. Using a cannula can certainly help with avoidance of arteries by slipping around them, but it doesn't mean that you will not inject into it. It doesn't give you certainty of not injecting into the artery. So injecting into the direction of the artery is probably the wrong thing to do. So if you know an artery is running this way, don't inject in that direction. You know, so inject perpendicular to it, not parallel to the artery, because you know it's going to go. You know, we know the general direction of arteries, so we can inject perpendicular to them rather than parallel. So if the frown, we know the frown is a big artery going up this way, we'll inject this way to avoid cannulating, basically, or injecting into, like you know, when you have a cannula in your hand or back before you have an anesthetic or an operation, you want to avoid slipping the cannula or needle into the artery. So go perpendicular to it. Now, I think the most important thing is for your practitioner to understand the anatomy and the various risks associated with each area. So if your doctor or nurse or injector understands the anatomy of what they're doing, then it's probably going to be less likely that you'll have a problem, because they know where the important structures run as a rule, as a general rule, and they try to avoid those areas. Okay, so I hope that was not too frightening a talk for you. It was meant to be educational and not to scare you, but I hope that I've informed you better about the possible risks, and as a result, maybe you can choose more wisely whether you want to have fillers done or not, or you can pick an appropriate practitioner with appropriate experience, or even ask them the right questions. If you have an existing practitioner already, ask them the questions about what they know. Maybe I've helped you in some way. So thank you for your time. It's been a fairly long video, but thank you for your time and listening to me. I hope this helps you in some way. in the future.